In this session, we discuss about the regions and quadrants of abdomen. For ready topographic reference of underlying structure, we divide the abdomen into 9 regions by 2 horizontal planes and 2 vertical planes. The upper horizontal plane passes through the lower part of the thoracic cage through the 10th rib of both the sides. When traced posteriorly, it meets with the lower border of L1 vertebra. The lower horizontal plane is also called transtubercular plane. It connects the tubercles of both the iliac crust. The right and left vertical planes are also called lateral planes. It's a vertical line drawn from the mid-inguinal point, which is midway between the pubic symphysis and anterior superior iliac spine. When traced up, it runs along the mid-clavicular line to meet the midpoint of the clavicle. So there are 4 planes drawn to divide the abdomen into 9 regions: the upper horizontal plane, the lower horizontal plane, the right lateral plane, and the left lateral plane. So we have the 9 regions of abdomen. On the right side, in the upper part, this is the right hypochondriac region. In the middle, right lumbar region, and in the lower segment is the right iliac region. On the left side of the abdomen, in the upper segment, we have the left hypochondriac region, left lumbar, and left iliac region. In the middle of abdomen, there are 3 regions from above downwards. The upper region is called epigastric region, the middle umbilical region, and the lower hypogastric region. So the 9 regions of the abdomen are right hypochondriac, left hypochondriac region, and epigastrium in the upper zone. In the middle zone, the right and left lumbar and umbilical region in the middle. In the lower zone, we have hypogastric region in the center, right and left iliac region laterally. Now coming to the organs which are underlying these regions, beneath the right hypochondriac region, we have the liver, gallbladder, the right kidney, the large and the small intestine. In the right lumbar region, the organs present are right kidney, the ascending colon, and parts of small intestine. In the right iliac region, the organs that are present are the ascending colon, the cecum, the appendix, and the parts of small intestine. Coming to the left hypochondriac region, the organs that are present underneath this region are the tip of the liver, stomach, spleen, pancreas, parts of the small intestine, and also left kidney. Now, in the left lumbar region, the organs present are descending colon, the left kidney, and parts of small intestine. In the left iliac region, the organs present are the descending colon, the sigmoid colon, and parts of small intestine. Coming to the epigastric region, there are many organs underneath the epigastric region. Those include liver, stomach, spleen, the adrenal glands, the duodenum. In the umbilical region, the organs that are present are duodenum, the entire coils of small intestine, and also transverse colon. In the hypogastric region, the organs present are the sigmoid colon, the parts of the descending colon, the reproductive organs are seen in the hypogastric region. So these are the 9 regions of the abdomen with the underlying organs. As we are thorough with the 9 regions of abdomen, the abdomen can also be divided into 4 quadrants. So this helps the clinician for localizing and identifying the patient's symptoms. So there are 2 lines drawn, the vertical line and horizontal line, which will divide the abdomen into 4 quadrants. The vertical line runs along the linea alba, starting from the suprasternal notch till inferiorly up to the pubic symphysis. So this is the first vertical line. The horizontal line extends along the umbilicus, intersecting with the vertical line and crosses to the opposite side. So to divide the abdomen into 4 quadrants, we place one vertical line and one horizontal line. The horizontal line and the vertical line intersects at the level of umbilicus. So we have now 4 quadrants for the abdomen: the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. Now we will just look into the organs that are placed beneath each of these quadrants. So beneath the right upper quadrant, the organs present are the liver, pancreas, stomach, large and the small intestines, the right kidney, and right suprarenal gland. The right lower quadrant has the reproductive organs, large intestine, the small intestines, the right ureter. The left upper quadrant has many organs which are present beneath it, including the liver, spleen, left kidney, left suprarenal gland, the small and the large intestine. The left lower quadrant has the reproductive organs, left ureter, large and the small intestines. So hope you have understood the organs that are present beneath each of these quadrants. So this helps us for a better diagnosis when a patient comes with an abdominal pain. So first we saw into the 9 regions of abdomen. The abdomen is divided by 2 lateral planes and 2 horizontal planes into 9 regions. The 9 regions are: on the right side we have 3 columns, on the left we have 3 columns, and in the middle we have 3 columns. On the right we have right hypochondriac region, the right lumbar, and the right iliac region. To the left, it is similar to that of the right, where we have the left hypochondriac, left lumbar, and left iliac region. In the middle of abdomen, we have the epigastric region, the umbilical, and the hypogastric region from above downwards. Coming to the quadrants of abdomen, it's a broader classification of abdominal regions. It is divided into 4 quadrants by 2 lines, one vertical line and one transverse line, both intersecting at the level of umbilicus. So we have 4 quadrants here: the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. And the organs are placed accordingly, as you heard in the video.
Ma'am, I think we have 2 more topics, which is like not so important when you come to the practical aspect. Yes. But they would definitely like to know, what if something comes up from that? Like, how do I understand whatever is there in that particular topic, right, ma'am? So can we just have a small glimpse of giving them an idea about any question, whatever comes from the anterior abdominal muscles of rectus or rectus sheath, or how they can answer or how they can understand it?
Okay. Let me share the screen now.
I can see students. Can you just yes, they can also see, ma'am.
Yes. Now, can you see this?
Yes, ma'am, they can.
Yeah. So this is the abdomen. What we are trying to study in whole is the abdomen has got 2 walls. One is the anterior abdominal wall, what you're seeing here, and the posterior abdominal wall. So both anterior and the posterior abdominal wall is made up of muscles, because they have to support the organs which are there inside the abdominal cavity. So today's session was, we were talking about all the regions what we see in the anterior abdominal wall. So in addition to that, we have to know about the muscles that are present in the anterior abdominal wall. So we have the muscles, they are all very flat muscles in the anterior abdominal wall, and they are arranged as 3 layers from outer, middle, and inner layer. So 3 flat muscle, and you can see there that what is marked in green is the aponeurosis. Any flattened tendon is called aponeurosis. So you can see the first muscle here, the outermost muscle is called external oblique muscle. The fibers are running obliquely, that's why the name external oblique. In the middle layer, we can see internal oblique, even that is ending in an aponeurosis. And the third, the innermost layer, is called as transverse abdominis. So these are all seen in the lateral aspect of the anterior abdominal wall. So if you see here, it's like this. This is the external oblique muscle you can see. More towards the lateral part of the anterior abdominal wall you can see here. And this white one is the aponeurosis. So when surgically, when we open up the abdomen, we will have to reflect these layers layer by layer. So first will be the skin. Then we have the fascia. Once we reflect the fascia, the first muscle we come across is this external oblique. So how do we identify that? You can see here, see the direction of fibers. The fibers are going downwards, forwards, and medially. So on the table, you see this muscle in such a way that all the fibers are directed downwards, forwards, and medially. So that is your first muscle of the abdomen called external oblique. Then once we reflect that, we have the next second muscle called internal oblique. Can you see the difference in the direction of fibers? Can you all appreciate that? Compared to the external oblique, can you make out how are the direction of fibers in internal oblique? The fibers are running upwards and medially. So clearly we can make out in dissection as well as in your surgical OTs that the direction of fibers will tell us the muscle. So internal oblique fibers, you can see it is running downwards. You can start from here down. It's running upwards and medially. So this is internal oblique. So once we reflect this internal oblique, we have the third layer of the muscle, that is transverse abdominis. The name itself tells you the fibers are running transversely. So we have three muscles in the lateral part, anterolateral part of abdomen. From outside to inside, we have three muscles: external oblique, internal oblique, and transverse abdominis. We identify this with the help of the direction of fibers. Is it clear? Is it clear to everybody? Yes. Now, another thing what you have to remember here is that the outermost muscle, the outer layer, that was our external oblique. When it goes down, you can see here below, it's getting folded. The muscle itself is getting folded. This folding is to form a ligament. We call this ligament as inguinal ligament. So we had three layers of muscle, that is external oblique, internal oblique, and transverse abdominis. The external oblique, the lower border of it, gets folded to form a ligament called as inguinal ligament. Very important, because we have to differentiate this while we are dissecting. The lower border of the external oblique is called inguinal ligament. You can see it is extending from anterior superior iliac spine to pubic symphysis. So next, after that, coming to the middle part of the abdomen, we have this muscle called rectus abdominis. This is the rectus abdominis. And you can see there, the muscles are in the form of segments. These are all the tendons in between. So we see three tendinous intersections for this rectus abdominis muscle. Any idea why these tendinous intersections are there? Anybody? What can be the purpose of such a tendons in between the muscle fibers? Anyone?
You can try answering if you know the answer.
So this will increase the power of the muscle. I know that you will all be knowing it. When the muscle is divided like this, the power of the muscle will be more. And this shows that embryologically, this develops as segments. The muscle is not one which is developing as a one element. They develop as small segments. That is about rectus abdominis. So for us to remember, we have three lateral muscles and one muscle in the center of the abdomen. So totally we have four muscles in the anterior abdominal wall. The three lateral muscles are external oblique, internal oblique, and transverse abdominis. The center muscle, what you see, is the rectus abdominis. Now this rectus abdominis, as you can see here on one side, it is nicely covered with a covering. There is a sheath covering it, and that is called as rectus sheath. So only if I remove this rectus sheath, the muscle will become very prominent. So how is this rectus sheath formed? It is formed by I told you, the abdominal muscles are having long aponeurosis. They have all the three, external oblique, internal oblique, and transverse abdominis. Everything is ending in an aponeurosis. So all the three muscles, the aponeurosis will take part in the formation of this rectus sheath. I think the detailed class regarding this, you have already got it. So this is in glimpse about the rectus sheath and the lateral abdominal muscles.
Thank you so much, Dr. Meera, for that really engaging session. In fact, I also got a couple of new things, or maybe some things which I actually forgot when I reached this stage part. So I would just like to move on to my students. Students, please do let us know what are your doubts regarding this topic, or do you want to ask ma'am about any of these topics in detail, or anything else what you want to know, or is there anything which is not clear? Is there anything which is requiring a bit more clarity? Yeah, ma'am, Arushi is asking what is rectus sheath?
Yeah, Arushi, the rectus sheath is the covering of rectus abdominis muscle. The sheath covering the rectus abdominis is called rectus sheath. And it is formed by aponeurosis of three flat muscles. That is external oblique, internal oblique, and transverse abdominis.
Can anyone say what is a clinical or applied anatomy of rectus sheath? I think that is one important question they can usually ask for, right, ma'am?
Yes, yes.
Can anyone tell any name, any particular name that you've seen in your Chaurasya? It's okay to be wrong. You can keep trying. I think, ma'am, you should tell them.
Yes. So you can see here, both the sides rectus abdominis are joined at linea alba. This white line in the center is called linea alba. So the minute the two muscles get separated, we have a gap in the rectus sheath, and that is called divarication of recti.
A very important topic, and it can be a commonly asked question in your viva, in your practical viva, because yes, I got it when I was in first year.
Yeah, whenever you have this divarication of recti, you can have herniation occurring.
Okay, ma'am, I think Sharon has one more doubt, which is does those tendon play an important role in inspiration?
Yeah, these are all muscles, accessory muscles of respiration. So they are not tendons actually, they are flattened tendons. We call it as aponeurosis. So when a patient is breathless, when his thoracic muscles are not enough, the abdominal muscles will come into picture. They take up the role. So it's correct, they play a role in respiration also.
Sharon, is it clear? Okay, and what about Arushi? Arushi, I forgot to get back to you. You got an idea about rectus sheath? Yes. So any other queries, students? Can I get a no if there is no questions? Okay, I think they're still figuring out some questions. Yeah, exactly. Can we see this in this section? Okay, which one are you talking about? The rectus sheath and anterior abdominal wall muscles? Okay, So we haven't taken it into consideration because it is not a frequently asked question in the practical side. Definitely we can consider this because when we get another specimen or something, we can make a small clip and we can upload it if it is,
Yes, yes.
if it is going to help you guys understand it better. Definitely. Thank you so much. So is it a good time to wind up then? Shall we wind up? Thank you, Manvi. Shall I get a thumbs up so that we can say bye for the day? Thank you, Sharon. All right, all right. So thank you, guys. Please do write down these notes, take it, keep it with you, revise it. We do have practical mock exam at the end of the marathon, and we can participate in it and get to know how exactly the practical exam happens in your colleges. So make maximum use out of all the sessions and keep the notes ready for you to revise at the end of the session. So yeah, you will receive all these contents in your app also. So do check it out in case you want to go for a revision or anything of that sort. So even that is there. And let's see in another session. So until then, it's bye from all of us from team Dr. Polaris. And on behalf of Meera ma'am also, I'm telling because there is a very bad connectivity there. Thank you so much, guys, for waiting. Good night. See you soon.